Hello everyone, I am Dr. Sathyanarayanan. I am a practicing physician and diabetologist, VS Hospital, Chennai. On the event of World Hypertension Day, which is going to be on May 17th, I'm going to tell you briefly about what is hypertension, how it causes, how we can prevent hypertension. So, what is a hypertension? Hypertension is otherwise called high blood pressure. How this happens is there's a force of the blood flows inside the blood vessels. If the blood vessels are tight, the heart requires to pump very severely so that it increases the blood pressure. That is the common way of definition of high blood pressure. Worldwide, as you know, that around some 13 billion people are affected with hypertension. In India alone, there is around 35 to 40%, both in rural as well as in urban area, inconsistently found around 35 to 40% of the people in India alone having hypertension. So, hypertension is not only one of the major cause of death, and also causes heart failure, myocardial infarction, that is heart attack, chronic kidney disease. So, fortunately, hypertension is easily diagnosed and treatable. What are the causes of hypertension? As you know that more than 80% of them, suppose they don't know that they are hypertension. You just go to the doctor, you find to check the blood pressure, they say that you're having a high blood pressure. So other 20% of the causes may be due to lack of physical activity, unhealthy diet, increased sodium intake. As you know that here in India and other Asian subcontinents, our sodium intake, our salt intake is more. Diabetes is another problem, kidney disease is another problem, obesity, improper diet, lot of fat in the diet. All these contributes to the high blood pressure. Apart from the causes which I told you before, the another common causes which causes hypertension is alcohol, increased alcohol intake, increased smoking, which also causes hypertension. So, if I want to know what is the blood pressure measurement which we can say that we are having a high blood pressure, we all know the normal blood pressure value is systolic of 100-120 and the low diastolic around 80. That means systolic means the upper part of the blood pressure and diastole means the lower of the blood pressure. This is 120/80 is the normal measurements for the hypertension. Suppose if the patient is having, or any person is having, want to know that what is his blood pressure, higher levels, it means. So the mild hypertension means if the upper level is around 130 and the lower level is around 80. So it causes mild hypertension. And any measurements above 140, like systolic version above 140 and lower levels above 920, it comes as a stage 1 type of hypertension. Then as the blood pressure increases, continues to be stage 2, 3 and 4. As you all know, hypertension can affect any age group. Even in children, the child will have increased blood pressure. That depends on the various causes for the hypertension. Invariably, any age group, both men and women will have hypertension. It is not that it is more the men, more the women. Anybody, depending upon the age, it is there. Most commonly, some of them having more than 25 to 30 years. At this age, at this scenario, you have hypertension there. So, how we can prevent hypertension? That is the most important topic now here. Prevention comes like, you invariably, whatever it may be the age, you check your blood pressures regularly. Take your medications regularly, blood pressure. If you're having a hypertension, just don't ignore it. Just take your medications regularly. Reduce your salt intake. That's very, very, very important. Salt intake should be less than 3 grams per day. So control, if you have diabetes, control your sugars. If you have kidney problem, take medications accordingly. Then do regular exercise, at least 30 to 45 minutes a day, at least not less, at least 5 times a week. Minimum is 5 times a week. If you walk even a whole week, fine, 30 to 45 minutes per day is very, very, very important. Then comes control your cholesterols, cut down on your alcohol, reduce your alcohol intake, stop smoking, okay, and then go have a good sleep. That is more important, and reduce your stress levels. That's all the most important things to control hypertension. I will conclude that hypertension is easily diagnosed and preventable disease. If you have any symptoms of hypertension, or if you feel that you want to check your blood pressure, contact your doctor and follow his advice regularly.